Hi, I'm Dr. Douglas Street. I'm a general medical doctor, and I want to show you how you can break free from diabetes. Now, there are over 500 million persons living with diabetes around the world, but you don't have to be one of them. I'm going to show you a path that can help you bring your blood sugar down, possibly to the level where you don't need to be on medication anymore, even if you're on insulin. Now, this may come as a surprise for you, but I want to show you in detail what you can do to normalize your blood sugar and off medication. Now, before we discuss diabetes remission, it's important to understand what is diabetes in the first place. Now, according to the American Diabetes Association, diabetes is diagnosed when your fasting blood sugar is 126 milligrams per deciliter, which is 7 millimoles per liter or more. The HbA1c is 6.5% or more, or your 2-hour glucose is 200 milligrams per deciliter or 11.1 millimoles per liter or more. In prediabetes, the fasting blood sugar is between 100 to 125 milligrams per deciliter or 5.7 to 6.9 millimoles per liter. The HbA1c is 5.7 to 6.4%, or the 2-hour glucose is 140 to 199 milligrams per deciliter, or 7.8 to 11.0 millimoles per liter. So the normal blood sugar, which is the normal fasting blood sugar, is less than 100 milligrams per deciliter, or 5.6 millimoles per liter. The A1C is less than 5.7%, and the 2-hour glucose is less than 140 milligrams per deciliter. Now, some persons may wonder, is freedom from diabetes really possible? As a matter of fact, when I was in medical school, diabetes was thought to be a permanent and progressive condition, meaning that once you're diabetic, that's it for life. But they have found in recent times that you can use certain interventions to get your blood sugar back to normal. Now, this is not considered as being a cure per se. The term that is used is diabetes remission. The American Diabetes Association considers you having gone into remission if your blood sugar remains normal off medication for at least 1 year. Now, how can you do this? You can do this through diet and lifestyle interventions, weight loss, and bariatric surgery. Now, bariatric surgery are different procedures that are done on your stomach to effect weight loss. And when should you try to bring your blood sugar down to normal? In other words, when would you want to try to get your diabetes in remission? The earlier the better. It has been found that those persons who have a diabetes for less than 5 years are much more likely to be able to get their sugar back down to normal for different reasons. Now, why would you not want to be on medication? And in fact, why would you want to put your diabetes in remission? There are several reasons why you may want to do that, such as you may not want to be on medication for the rest of your life, or you may want to take less medication. You may want to experience a better quality of life. You may want to try to reduce the chance of you getting complications, or you may want to have some sense of accomplishment. You can do all of this by bringing your blood sugar down, hopefully, to normal. Now, in order for you to understand the different interventions that bring your blood sugar down to normal, it's important to understand what causes diabetes in the first place, right? Now, we're going to be focusing on type 2 diabetes. Type 1 diabetes is not really reversible, but type 2 usually is. Now, there are two main contributors to the development of type 2 diabetes. One is genetics, and it means that diabetes type 2 runs in families. And the other one is inflammation. Now, what is inflammation? Inflammation is a product of your immune system. When your immune system reacts to different things, it produces inflammation. And specifically in the case of diabetes, it is what we call chronic low-grade inflammation. Chronic means that the inflammation has been going on for quite some time, and low grade means that it is not so noticeable. The symptoms are really not very severe. There's also, it also has to be systemic inflammation. It cannot be localized. So it means that it's affecting the entire body. Now, this is something that is definitely modifiable. You can reduce inflammation in your body, and that is one of the main factors that you can use to bring your blood sugar back down to normal. There are other factors that contribute to diabetes, such as stress. Persons who are under stress, usually their blood sugar will go up, and there are certain medications that can push up your blood sugar. These medications include steroids and statins. So you have to really be careful about these medications because they can push up your blood sugar. Stress is also something which is modifiable. You can use interventions to bring your stress level down, and this can go a far way in keeping your blood sugar down or in bringing it back down to normal from being high. What is the normal state of affairs? Now, when you eat food, it is digested and absorbed into your bloodstream. Now, this triggers the production of insulin, and the function of insulin is to bring about the absorption of sugar from the bloodstream into your body tissues, especially the liver and your muscles. This is usually due to a feedback system, meaning that when your blood sugar is high, the insulin level goes up. When the blood sugar comes back down to normal, then insulin level is reduced. So that usually ensures that the blood sugar is kept within the normal range. The problem with inflammation, as we said before, is that it can reduce the effectiveness of the insulin. So even when the insulin is produced after your food is absorbed into your bloodstream, the body cells do not respond in the way that they're supposed to. So the blood sugar remains high. And this normally happens in persons who are susceptible to becoming diabetic. In other words, persons who are prone to become diabetic, usually because of their genetic makeup. The good news is though, is that if you can bring that inflammation down, then the insulin can once again start to function effectively in bringing your blood sugar down. So the inflammation is one of the main targets when you're trying to get your blood sugar back to normal. Now, in order for you to understand how to bring inflammation down, you need to know what are the things that cause inflammation to be high and what you can do to bring it down. Now, there are several factors that can do that. The first one is diet. There are certain dietary practices that can increase your inflammation, and there are others that can reduce it. Exercise as well is also important in the levels of inflammation inside the body. The amount of water that you drink, the type of sunshine and the amount of sunshine that you're exposed to, and there is something that we call temperance. Now, temperance is basically doing the right amount of the good things and none of the bad things. And so that is another thing that affects the levels of inflammation inside the body. The air quality as well and the amount of fresh air that you get also affects the level of inflammation in the body. The amount of rest and the timing of the rest that you have, the quality. Also interaction with other persons. This can be positive or negative, and also your belief system can affect the inflammation levels inside the body. And another factor is the intestinal microbiome, which is the composition of bacteria inside of your intestines, is a major factor behind the level of inflammation inside the body. So we'll discuss that as well. And there is a role for inflammation, there is a role for supplements in regard to the level of inflammation inside of your body. So let us look at how the diet can affect inflammation. There are basically two types of diet. There's a pro-inflammatory diet, in other words, the one that increases inflammation, and there's the anti-inflammatory diet, in other words, the one that reduces inflammation. Now, the pro-inflammatory diet has animal-based foods, it has processed foods, it has high glycemic foods, high caloric, the foods are inappropriately cooked, and it involves frequent and late eating. The anti-inflammatory diet, on the other hand, is plant-based. It has unprocessed foods or minimal amounts. It involves using low glycemic foods. It is a low caloric diet, and the foods are appropriately cooked, and there is properly spaced eating times, and it involves fasting. So let us look in more detail as to what the pro-inflammatory diet is like, because most persons are on this diet, which is one of the reasons why they develop diabetes. So the pro-inflammatory diet is one that is animal-based. The protein source is animals. So we're talking about things like chicken and fish and pork and other red meats, dairy products, and eggs. Animal-based foods, they do increase inflammation in the body, and part of the reason for this is that they're absorbed into your body fairly quickly. They don't require a lot of digestion. So foods that are absorbed into your system quickly, they tend to increase inflammation in the body. They also affect your intestinal microbiome, which also contributes to the inflammation inside the body, which is another reason why you want to avoid animal-based foods. So a lot of persons don't like the idea of avoiding animal-based foods, but to be honest with you, in order for you to really be serious about diabetes remission, this is a very, very important step to take to avoid all animal-based foods. Also, processed food should be minimal, and this is whether it is a plant-based food or animal-based food. Of course, you should avoid animal-based foods. So things like bacon and franks, which are processed animal-based foods, they should be avoided from these two for these two reasons. But even plant-based foods that are processed should really be avoided. So for example, you go for the brown rice rather than going for the white rice. So for your soy products, go for the unprocessed soy products. So use foods that have the whole soya bean, and avoid those food and drinks which use processed soy. So we talk about those vegetarian substitute foods that should really be avoided as well. They're not healthy. Soy drinks which use soy protein isolate should also be avoided as much as possible, because even though it is plant-based, it's not that healthy. It's not really healthy for you. The high glycemic foods, and high glycemic foods are food where the glycemic index is over 70, and we'll discuss this in more details in subsequent communication. But high glycemic foods include things like Irish potato, flour-based foods, wheat flour that is, pumpkin, cassava. These foods have a high glycemic index, meaning that their glycemic index is over 70. You can get the glycemic index of a food by going online to get information. Just look up the glycemic index of the food and you can see what the glycemic index is. So these are the kind of food that you want to avoid because they are pro-inflammatory. The high caloric foods, especially large and fatty meals, you want to avoid those. You want to keep your calorie intake down. That's a very important part of the remission process, getting towards remission. The total amount of calories that you should be having per day should be between 500 to 1,500, and this can help you to lose weight and also to control the blood sugar and help your body to recover from this diabetes state. Inappropriately cooked foods should really be avoided, so things like fried foods and baked sweet potato, cooked vegetables. These foods don't really help you that much. As a matter of fact, baked sweet potato glycemic index is much higher than when it is boiled. So it's best to have the boiled sweet potato rather than the baked All right. Late eating should be avoided as well, and we're talking about eating after 4 p.m. And as a matter of fact, as a diabetic, you should really avoid eating after 4 p.m. 6 o'clock is already much too late. And as a matter of fact, the best time to complete your eating is at about 2 o'clock. So you should be having your second meal between 2 and 4 o'clock, something in that time. And try to have your meals towards the earlier part of the day rather than the latter part. The most of your calories should be coming from your breakfast, and we will discuss that in more detail in subsequent communication. Snacking is also not really recommended, and of course the traditional teaching is that a diabetic should be having 5 meals a day, 3 large meals, relatively large, and 2 snacks. But this kind of eating has been scientifically shown to increase your risk of diabetes and also can worsen your diabetes. So it is not really a healthy practice, even though it is frequently taught. The best way to have your meals is to have 2 meals per day, 2 or 3. That is a better approach to use, and that meal should be your breakfast. Usually about between 6 and 8 o'clock in the morning, and then you wait until about 5 hours later to have your at least 5 hours. It can be more. At least 5 hours later, you'll have your second and should be the last meal for that day. And some persons can't even go by on 1 meal per day. That is even better. Some persons' metabolic rate is very low, so they can manage on 1 meal per day or 1 solid meal per day, and the other one may be vegetables. It depends on your metabolic rate. But snacking should really be avoided. There's no such thing as a healthy snack. All your eating should be confined to your meal times. A pro-inflammatory diet is one that increases your weight as well, and of course, weight plays a big role in diabetes. So you want to get your weight down to the ideal, which is a body mass index of between 20 and 25. So a pro-inflammatory diet makes it difficult for you to lose weight, so you should really be avoiding it for that reason as well. Now, this is a diet that you really want to be on, the anti-inflammatory diet. This is a diet that reduces inflammation in your body. When your inflammation is reduced, it allows the insulin to start working properly again. So this is a very, very important diet that you want to be on. The anti-inflammatory diet is a plant-based diet, so it has no animal-based foods in it. So you get your proteins from plant-based sources. Talk about your peas, beans, nuts, and seeds. It's important to ensure that you combine these foods in the right proportions. So you should be getting about 25% of your food intake from these plant-based proteins, and 25% should be coming from your healthy carbohydrates, 20% from your fresh fruits, and 30% of your diet should compose of vegetables, fresh and a variety of vegetables. So when you're getting your proteins from plant-based sources, it's important to get all the essential amino acids from your foods. And in order to do this, it's important that you have them in combinations. For the most part, there are some foods there are some plant-based proteins that are complete, but most of them are not complete, which means that they don't have all the essential amino acids. So therefore, you have to get them in combinations. So, for example, having peas and nuts will give you all your essential amino acids, and you don't have to have it at the same meal, but it's important to have it on the same day. So, having, for example, your black peas with your breakfast and having your almonds with your lunch, that will give you, once it's the right amount, it will give you all the essential amino acids. But even if you have peas and say brown rice, you can also get all the essential amino acids from that as well. So you don't necessarily have to combine peas and nuts every day, or seeds. Also, it's important for you to have your fruits and vegetables, and this must be fresh and having a variety as well. Especially the bright colored ones, those ones are the best ones. Whole grains you should be having as well. We're talking about things um, like your rye flour, your spelt flour, your quinoa, your brown rice. These are some examples of some whole grains that you should be having as part of your diet. Um, you should also have low or medium glycemic foods, and this means that these foods don't spike your blood sugar very much. The glycemic index is a measure of how much of a particular food will increase your blood sugar, and it goes from 0 to 100, and the glycemic index that you're really aiming for is less than 70. So foods that are over 70 you should avoid. Um, so foods that are low or medium glycemic index foods include sweet potato, green bananas, yam, prunes, we mentioned quinoa, rye flour, old-fashioned oats. These foods have a low to medium glycemic index, so you want to be having them as part of your diet. You also want to be having a low calorie diet, and you should target between 500 to 1,500 calories per day. If you're practicing intermittent fasting, then on your fasting days you should confine your calories to about 400 or 500 calories on those days. On regular days you should be going for 1,500 calories on those days, and we're going to be looking at how you can calculate the calories in your food and in your daily intake, so you can be more aware of that in later communication. So make sure that you look out for that. Confining your calories helps your body to keep the inflammation down, so it's very, very important. Also, make sure that you don't inappropriately cook your food. So foods that can be consumed raw, you have them raw. So your vegetables, your ripe plantain, those can be consumed raw. When you have those foods raw, you get all the nutrients from them. Foods that you can't eat raw, like your rice or your yellow yam or your green banana, those you can boil. Steaming is also okay, the temperature is not too high. And then the flour-based food, the healthy flour like rye and spelt and other healthy flour, they can withstand the heat, but other carbohydrate sources cannot withstand that heat, so they'll break down more and their glycemic index will go up. It's also important to time your meals properly, so have enough time between your meals, and we usually recommend about 5 hours. So so you can have your breakfast, let us say between 6 and 8 o'clock in the morning, and then having your lunch probably by about 12, 1 o'clock thereabouts, depending on what time you have your breakfast. And that allows your body to recover from the inflammation that was produced by your meals, and allow your blood sugar to come down as well. You should also practice fasting. Intermittent fasting is a popular type where you have on 2 days of the week you restrict your calorie intake, and then the other 5 days you have a regular amount of calories, which we spoke about earlier. There's also time restricted eating, where you confine your eating to between 6 to 8 hours out of the day, so you don't spread out your eating too much. You confine it to those hours. So for example, and that should be in the earlier part of the day. Don't recommend you confine that time to the later part of the day. You should be having it earlier. So say between 8 and 8 in the morning and 2 o'clock in the afternoon. That is about 6 hours. So between 6 and 2, that's 8 hours. That is also quite fine. That helps your body to make best use of the healing mechanisms that take place in the evenings, so that you recover in good time. The anti-inflammatory diet can cause weight loss, which is a very important part of helping to reduce the inflammation and also help your body to recover from the diabetic state. Alright, so let's give a little bit more information on the carbohydrates. Now, as I mentioned before, it should be about a quarter of your dietary intake, and you should be going for the whole grains, avoid the processed carbohydrates And even wheat products, whole wheat bread, not recommended. And the reason is wheat is a fairly high glycemic food, and it also has gluten in it, which promotes inflammation inside the body. So wheat products are not recommended as part of this diet. You also want to be using the brown rice as mentioned before. Those whole grains are quite healthy. You should have those. And as I mentioned, have the low glycemic foods, but and avoid sugar. This is a well-known information. Sugar should really be avoided. So don't have food with added sugar. Foods that naturally have sugar in them can be consumed, but in moderation. So if your fruits have sugar in it, it's okay for you to have that, but in moderation. Shouldn't be more than about 20% of your dietary intake. You can add fiber to your foods too, and this can help to reduce the absorption of a food from your intestines. So like your grounded flaxseed, your chia seed, and your glucomannan, these can be added to your meals, and they help to reduce the glycemic index of your foods so that it keeps the inflammation level down. Your proteins, as I mentioned before, should be also about a quarter of your diet, and the amount that you should be having per day is about 0.75 grams per kilogram of your ideal body weight. So for females, it's about 45 grams per day, and for males, about 55 grams per day. Don't overindulge on your proteins, because proteins do produce some toxins in the body. So you should go for the right amount and don't overindulge. And as mentioned, your protein should be plant-based, and we spoke about those earlier. You should avoid all animal-based sources of protein. Fruits is a very, very important part, and it should be about 20% of your diet, as mentioned before. And you should be having about 2 cups with your breakfast. I don't usually recommend that you have fruits later than that, and this is because of the sugar intake. You should be getting most of your calories in the morning when the body can manage them better, not in the later part of the day. It should be fresh, brightly colored. It can be blended, but don't strain your fruits. In other words, don't make fruit juice. Fruit juice has the fiber removed. It is no longer healthy. So make sure that you have the fruits, and don't so much make juice out of them and drink that. That's not good for you. Your fruits can be dried, like prunes and dates. Vegetables should be about 30% of your diet, and the amount you should be having is about 3 to 5 cups per day. The more vegetables you have, is better for you. Vegetables are very, very good at reducing inflammation in the body. They have a low sugar content, and have a high fiber, and they have high in antioxidants. Vegetables is really a very, very important part of your journey towards remission. So the more that you have is better. I normally recommend that you have it with your second meal. The reason is to keep your inflammation down going into the later part of the day, when the body is starting to prepare for the healing phase of the daily schedule of your body. So you should try and have it at that time. And on days when you're doing intermittent fasting, you can have vegetables on those days, because that helps to bring the inflammation down even further. Vegetables should be fresh and brightly colored, having a variety that is quite healthy, and they can be blended. But again, don't strain them, because you're going to take the fiber out, which is very important. Vegetables help to optimize your bacterial microbiome in your intestine. So it's a very, very important part of your diet. Now, fats do have somewhat of notoriety when it comes on to diabetes. There are persons who will tell you that fats cause diabetes, but I want to just tell you that using fats in the right way can actually help you in your journey towards remission. Now, first of all, it must be a minimal amount. So excessive amount of fats, it's not going to help you. It must also be plant-based, and you should avoid cooking your oil or exposing it to excessive amounts of heat. Now, when you add oil to your food, healthy oils, which is, plant-based oils, it can slow down the absorption of nutrients into your body, and this can help to prevent your blood sugar from going too high. So it can help you once you have the right amounts, but it's important to ensure that you don't go over your caloric intake for that particular day. So once you don't do that, it should be okay. There are certain fats that are healthier than others. Monounsaturated fat is probably the best one to get, and you can get those from avocado, almonds, olive, and canola oils. So once you use those, it should be okay. You should also use virgin or extra virgin oils. They have been exposed to no heat or limited heat, and that certainly can help you to reduce the inflammation in the body, keep your blood sugar down, and it shouldn't cause too much of a problem with doing that. You can also add oil to your food, but this is to your plate rather than to your pot, because as I said, you have to avoid heating it because that can cause harm to your body. Now, as we mentioned before, it's important to have proper timing with your foods, and we spoke about this before. Breakfast should be a main meal, and your meals should be spaced appropriately. And it should you can include time restricted eating, intermittent fasting into your weekly schedule to get the most out of your meals. Now, exercise is one of the key interventions that you want to be practicing in order to help you along your remission journey. Now, research has shown that exercise can help to prevent you from becoming diabetic in the first place. And if you already have it, it can help to improve your blood sugar control. So this is not something that you want to really leave out of your weekly schedule. Now, what they have found is that the evening time is the best time to exercise for a diabetic. And this may be because exercise helps to reduce inflammation, and reducing inflammation in the evening time is very important in preparing your body for the healing that you will need to experience in order for remission to take place. So exercise is very, very important, and the timing is also important. Now, how much exercise should you get? Now, this depends on the intensity of the exercise. Usually for moderate or low intensity exercise, 30 to 60 minutes of exercise is usually enough. The lower the intensity is the more time you'll have to spend. So if you're doing low intensity exercise like walking, then you may go up to 60 minutes. And if you're trying to lose weight, you may need to go even more than that, maybe 75 minutes or 90 minutes, because the more exercise that you do is the more you will lose weight. Now, if you're doing moderate intensity exercise like jogging, then it's important that you do it for about 30 minutes. And if you're doing high intensity exercise such as running, then about 20 minutes is normally sufficient. How many times you exercise per week also depends on the intensity of exercise that you're doing. Again, if you're doing low intensity exercise like walking, then you may need to exercise about 6 times per week. If it's medium intensity, 4 or 5 times should be okay. And if you're doing high intensity like running, then about 20 minutes is normally sufficient. How much time do you exercise per week? About 150 minutes. Research has shown that that amount of time in exercise per week is actually helpful along your remission journey. Now, what they have found is that you can vary the intensity of the exercise that you're doing, and also the type of exercise that you're doing during the exercise session. So there are different types of exercise. There are stretching exercises, there is aerobic exercise, and balancing exercise. What is recommended is that you try to vary the type of exercise that you're doing during that session, also the intensity. So when you're doing your aerobic exercise, then you can vary the intensity. So sometimes you're walking, sometimes you are jogging, and sometimes you are running. This has been found to be most beneficial than doing one intensity exercise. Now, it's also important that you do not over exercise, because this can actually increase inflammation inside of your body. So it's best to be moderate in how much exercise that you're doing. Group exercise has also been shown to be more beneficial than solo exercise activities. So for example, if you're doing um, um, playing table tennis or playing tennis, playing badminton, and other physical activities that involve other persons, it's actually been shown to be more beneficial than if you do exercise on your own, such as walking or jogging, right? So try and include some, physical outdoor games as part of your exercise program. It's also important that apart from you doing your exercise session, whether it is morning or in the evening, that during the course of the day when you're at work, that you still do some physical activity. So don't be sitting at the desk all day. Make sure that you get up, you move around, you walk up the stairs. Even when you're moving from your car to your office, make sure that you park far enough away that you get some physical exercise out of even that activity. And exercise should really be intensified, as I said, when you're trying to lose weight, and you should try to lose about between 5 to 10% of your body weight, especially if you fall into a category where your BMI is over 30. And even if your BMI is between 25 and 30, you should still try and get your BMI down to below 25, because that is very, very helpful in along your remission journey. And weight loss has actually been shown to be very beneficial in in helping you along the remission journey. So that is something that you may need to do if you have too much weight on. Having adequate water is a very important part on your remission journey. It has been shown to help to prevent diabetes and to improve your blood sugar control if you are already diabetic, if you're having enough water. Water should be potable. It should not be contaminated water. You should be drinking at least 3 liters of water per day to get the benefits of it. And you should be having room temperature or warm water. Cool water is not recommended. And you should also try and drink your water earlier during the day rather than later, because if you have it later, it may keep you up at night, going to the bathroom and interfere with your sleep. So try and have your water earlier during the day rather than later. And you do get other benefits from drinking enough water. You will improve on your joint health, and you also will experience better gut health if you're drinking enough water. Healthy sunshine is an important part of your remission journey. Sunshine has actually been shown to help to prevent diabetes, but the sunlight between 10 a.m. and 4 p.m. is not usually so healthy for a lot of places. So it's best to go before 10 a.m. or after 4 p.m. And some places you may even have to go earlier than that, such as 8 a.m. So it all depends on where you are, how strong the sunshine is, and the time of the year. Now, how much time you spend in the sun depends on your complexion. Person with lighter complexion, they can spend a shorter time, such as about 15 minutes. But if you have darker complexion, then you may need to go for about 30 minutes per day. The sunlight does help your body to produce vitamin D, but it has other benefits. It helps to improve on your sleep, especially early morning sunshine, and it helps to also improve your mood. So you do get other benefits from getting healthy sunshine apart from improved blood sugar control. Now, practicing temperance is a very, very important part of your remission journey. Now, temperance, as I mentioned before, is having the right amount of the good practices and avoiding the bad practices. And this has actually been shown to help to prevent diabetes. Now, some of the unhealthy practices include using of drugs, especially recreational drugs, smoking and alcohol. I also recommend that you try and avoid caffeinated products as well. And the reason for that is that you don't want to be doing things that are addictive, it may not really work out so well for you. So try to avoid anything that's addictive from getting into your system. Alcohol is harmful to your pancreas, so you really want to make sure that you avoid that. You want your pancreas to be functioning properly. It also affects your liver. Liver is important in your blood sugar control as well. So make sure that you avoid alcohol. Smoking increases inflammation in your body, so you want to avoid that. And the other drugs are also harmful to your body in different ways. So ensure that you avoid those drugs so that your body can have a smooth recovery. Try also to avoid the use of household chemicals, things like bleach and disinfectant, artificial fragrances, insecticides, pesticides. These chemicals are harmful to your body. They increase inflammation, and as I mentioned before, you want to keep your inflammation down, so it's best to avoid using these chemicals and use instead things like soap, water, vinegar, baking soda. There are other things that you can use to clean your house and your environment, whether it is a home or work. This is a very important part of your journey as well. And there are other benefits that you can gain from this. So it's not just about your diabetes. It helps you with, for example, allergic problems and so on. So make sure you practice with temperance so that you can get the benefits for your remission journey. It's also important to get your fresh air, and fresh air is clean air at the right temperature. So warm air is not something that you want to be exposed to too much. The temperature should be moderate. Or cold air also, it's not that good for you, so it should be the right temperature, the ambient temperature. You should also try to keep your environment properly ventilated. Having healthy fresh air, it's something that can help to prevent diabetes. So you want to open up your homes at least at certain times of the day. Some places are very hot, so you may not be able to have your house open all day, but it should be open for a certain number of hours to allow fresh air to pass through. And part of the reason is mold tends to grow in environments that are not properly ventilated. So mold increases inflammation in your body, which you want to avoid. Also, try and avoid smoke in your environment. So try not to burn, burn things around your homes. This also can be detrimental to your health. New furniture and carpets and paint, these cause indoor pollution. So just be aware of that. If you're buying any new furniture recently sprayed, try and ensure it stays somewhere where it's properly ventilated before you take it into your homes. Also be aware of carpets. Carpets release certain volatile chemicals into your air in your inside of your homes, which can also prove harmful. And environmental pollution, external pollution can also be harmful. Car exhaust and so on, in built up places in the cities, these places produce a lot of pollution, and these produce inflammation in the body, which are detrimental to your health. You'd want to try to get fresh air so that you can benefit from that. Dust and also construction activities which produce dust also are not really good for you. They increase inflammation, so you want to get fresh air as much as possible so that you will not be hindered in your progress towards remission. And of course, there are many other benefits to having fresh air: clearer mind, better concentration, and it can better focus on what you're trying to do when you're working towards remission. Getting adequate rest has been shown to help to prevent diabetes, and if you're already diabetic, it can improve on your blood sugar control, so it's something that you really want to prioritize. There are threats to us getting enough sleep. Shift-based work, where you're working at night sometimes, that has been shown to increase the risk of diabetes. So if you can avoid working at nights, that is much better for you. Media also can interfere with you getting enough sleep, going on social media, watching television late at nights. These practices can reduce the opportunity for you to get enough rest. Leave sleeping in a noisy environment. that can interfere with you getting adequate rest as well. Family commitments also can interfere with you getting enough sleep. Chronic illnesses, especially painful ones, can interfere with you getting enough sleep. Stress also can interfere with your ability to fall asleep and to stay asleep. So that is something that may need specific intervention if that applies to you. How much sleep should you get? About 79 hours has been recommended to help you along your remission journey. But the timing is important. You should try and go to sleep by latest 10 o'clock at nights. And because if you go to bed later than that, then you're not going to get as much out of the rest that you're getting as when you go to bed earlier. So try and ensure that you don't go to bed too late. Even if you're getting the 79 hours, you still not get as much benefit from it if you go late. You should try practice getting weekly rest as well, taking at least a day off per week. That is helpful, and also taking vacation. That is also important for you to recoup and for your body to repair itself. You can improve on your sleep by ensuring that you have a quiet environment, that the lighting is appropriate for you. Of course, darkness is usually better in allowing you to get enough rest, and making sure that you have a scheduled time when you rest. You don't just go to sleep when you feel like. Have a scheduled time. And the temperature also may impact on your quality of sleep. So ensure that you're in a temperature where it's helpful for you to fall asleep. Try also to prepare yourself for sleep. Don't be doing things that are overstimulating before you go to bed, such as being on your phone or exercising. Some persons, exercise can interfere with their sleep if you do it too close to bedtime. You can also practice relaxation techniques like breathing exercises that can actually help to prepare you to fall asleep. And certain supplements can help, things like lemon balm or magnesium, melatonin, and there are many others. These are natural supplements and non-habit forming. These can help you to get adequate sleep if you're having a challenge in that area. Now, sleep has other benefits. It's not just about your blood sugar control. It helps with your concentration and your mood. Yeah, so it is something that you really want to ensure that you have when you're working towards remission. Now, healthy social engagement is very, very important in your remission journey. Healthy social engagement can help to prevent diabetes, so it's very, very important to be properly socially engaged. Now, there are certain threats that can interfere with your ability to get good social engagement, such as work. Some persons work so many hours that they don't have the time to have proper interaction with their families and friends. So it's important for us to set a schedule to have good social engagement. Media is another thing, especially these days with social media. We spend so much time engaging with social media that we don't have healthy amount of time with our friends and family. So we should recognize these threats and ensure that they do not interfere. Families sometimes can also interfere. Some persons are very, you may want to restrict your engagements, your social engagements. So that may not be so good. If you're, very ill, then you may not be able to move around as much, and that can limit your engagement. Stress also, you may want to withdraw from other persons because you're feeling stressed. That can also have a negative impact on your opportunities for social engagement. But there are many opportunities like religious activities and going to church and so on can give you good social interaction. So that is something that I personally encourage and I practice myself. So healthy social engagement in those environments are good. Clubs also usually have good social engagements as well, so you could get involved in that. Sporting activities also, once they are healthy, it's also good. Charitable organizations that can sometimes give good opportunities for healthy social engagement. So these are some things you can utilize to help. Now, they benefit you in many different ways. They help you to get some information, especially if you go to church, you can learn about how to live your life in a healthy way. and it also gives the opportunity to help others. When you help others, it has been shown to help to reduce your stress level, and it can also help you to your bodies to heal. So helping others is a very, very important part of your remission journey. It's not all about you. Helping others benefits you, so it is something that you should intentionally do, not for selfish reasons, but when you genuinely help others, it is beneficial to you as well. And it also helps your peace of mind. Um, when you help somebody else, you have a sense of accomplishment. So helping others is a very important part of your journey also. Now, stress is something that can really interfere with your remission journey. So you should ensure to utilize stress reduction techniques. Now, stress reduction techniques can help you to prevent diabetes. And when you have diabetes, stress can even increase your blood sugar. So it's very important to keep your stress level down. Now, there are a lot of threats to stress reduction, such as work, as I mentioned before. You may have to deal with persons who may not be so reasonable. Also, the long hours, also the amount of work that you're doing. These things can increase your stress level. Media, believe it or not, sometimes persons go on social media, they see other persons who seem to be living wonderful lives, and they may feel left out. They may feel like they may feel a sense of loss, and that can be a source of stress as well. Family oftentimes is one of the major stresses that we have. Sometimes we have unhealthy interactions in the family, and that can increase your stress level. Chronic illnesses, the arthritis and so on, if you have migraines, these illnesses put stress on the system, and can increase inflammation in your body. But you can do some preventative interventions, such as proper planning. Don't wait until the last minute to get things done. Plan out your schedule properly so that you can get things done in a timely manner, so you don't have to do things last minute and staying up too late to do them, missing out on the benefits of sleep. Avoiding certain situations can be helpful when it is possible and it is healthy. Avoiding certain stressful situations might be helpful. Preparing for stressful situations. If you're going into a situation that is stressful, practicing can help you, preparing your mind that what you're going to do, what you're going to say, rather than going in without any kind of preparation. That is also helpful. Also, having a healthy spiritual life, having prayer, singing songs, having healthy engagement, this can also help to reduce the stress. Limiting social media is very, very important, and having a healthy diet and lifestyle and can help your body to manage stress better. If you're having a stressful life and you're not eating properly, then this can even limit, it can have a negative impact on how your body responds to that stress. Now, there are many different interventions that you can do if your body and mind are stressed. Relaxation techniques, and this is something that you can actually do some research on. Breathing exercises, as we mentioned before, is one type. So you can use that to help you, and that is something that we can look at another time. Mindfulness meditation is also very helpful, and that is something you can learn more about as well. Being grateful about your life, even though things might be difficult, there are still things to be thankful of, your family and so on. So being grateful is very important in bringing your stress level down. Listing the things that are going well for you, and even being grateful about the things that are negative, that you may see as negative. Even that can help to reduce the impact it has. If you have even your diabetes, you can be thankful that you have diabetes. Yes, it may sound strange, but when you have that attitude, it kind of helps your mind to be more calm, because when you're diabetic, what it does, it kind of pushes you to do the healthy things that you may not be doing if you were not diabetic. So even though it may seem like like a bad thing, if you're grateful for it and you have an attitude towards it, it can actually be helpful in you getting on the right path and living a healthier life. Helping other persons is also very, very good. Having healthy social connections, having healthy fun, doing do-it-yourself activities also can help to reduce stress, and sometimes you may need to get professional help to help you to reduce stress. Now, having healthy intestinal bacteria is very, very important part of getting the inflammation down. Bacteria living in our intestines, and these are very, very influential in the amount of inflammation inside the body. So having a healthy intestinal microbiome can actually help to prevent diabetes. So that is something that you definitely want to work on. There are certain threats to the intestinal microbiome, such as your diet. We mentioned before that some diets cause the intestinal microbiome to be unhealthy. So you want to have the anti-inflammatory diet that we've been speaking about. Inheritance, your genes does have an impact on your intestinal microbiome. Stress also has a negative impact on medications such as the stomach medications, the pain medications like the NSAIDs have a negative effects. And there are other medications. Antibiotics also have a negative effect on your intestinal bacteria. So you should really try and limit how you use these medications. If you have to use them for a limited time and avoid them when you can, because they can cause your body to have, cause your intestines to have an unhealthy composition of intestinal bacteria. You can improve your intestinal bacteria by having probiotics, good probiotics. Also prebiotics, which are nutrients for for the healthy bacteria. Probiotics are the healthy bacteria themselves. Having an anti-inflammatory diet can help to improve your intestinal bacteria. Getting proper rest, getting healthy exercise, and spending time in nature is helpful for your intestinal bacteria. And there are many other benefits of healthy intestinal bacteria. These bacteria help your state of mind, which is very important when you're trying to work towards remission. Because if you have unhealthy bacteria in the system, this can cause you to have less motivation to do the right things, and so it can kind of lock you into these practices that are harming your system. So having these practices can help you in many different ways. Now, supplements can be a helpful part of your remission journey. Remembering that diabetes is primarily caused by high inflammation, so antioxidants can be very helpful in reducing the inflammation to allow your body to recover from the diabetes state. Antioxidants such as turmeric, muscadine grapeseed, coenzyme Q10, reishi mushroom, vitamin D, these may be very helpful for you to reduce inflammation in your body. Supplements that improve your gut health, such as prebiotics and probiotics, they can also be very, very helpful. Fiber help to slow down the absorption of nutrients from your gut into your bloodstream, and it can be helpful in keeping your blood sugar under control as well, and putting less stress on your pancreas. So like glucomannan, flaxseed meal, xanthan gum, and other types of soluble fiber can prove very, very helpful. Cinnamon powder also has been shown to help. So these are just a few supplements. We will discuss other supplements that can be used in further communications. Make sure you stay tuned for that. Now, I'll be the first to tell you that this journey towards remission is not an easy one. It does require a high level of commitment. It also requires a high level of consistency. Consistency is important because when you go off track, it takes a while for you to get back on track. So it's important that you are consistent in what you're doing. That will achieve the best results. It's also important that you are patient with yourself, because sometimes you may go off track, but you just try to get back on track as quickly as possible so that you can continue your journey. You should also make sure that you keep on learning. This is not all information that you can have. There is a lot of other information that can be helpful. So keep your mind open and make sure that you keep learning. I will be sharing with you more information as time goes by so that you can get more details about the things that you should and should not do. And get help. Ensure that your support group is helping you. Make sure that your family is there to help you. Ensure that your physician is there to help you. And this may prove very, very important to keep you going when things may not be going according to plan. So I do thank you for watching this video. It takes a lot of commitment to watch it to the end. And as time goes by, you're getting more information, so make sure you stay tuned. And as we continue along your journey towards remission. Thank you very much.